The fight to repeal Obamacare, the House Freedom Caucus pushing for a swift repeal of the Affordable Care Act, but House Republican leaders are insisting they will take a step-by-step approach to overhaul the law. Take a listen. Okay, could you scroll up then in that case? Republican Congressman Mark Sanford has a new Obamacare replacement plan that he will introduce tomorrow. The House Freedom Caucus member joins us now. Sir, thank you so much for joining us. I mean, one of the biggest questions that consumers have out there is about the timing. And they want to know, are you going to be able to put a new plan in place before the end of the year? Not will it take effect, because I understand the rollout might take some time. But do you think that you will have something ready to go that you'll be able to get by and get passed before the end of the year?
I would hope so, and that's ultimately what this bill is about. It's, in essence, a bicameral approach. This is the companion bill to what Senator Rand Paul has introduced on the Senate side. And so I get it. I mean, people are really anxious about this at home. For the reasons you've articulated, people don't want to see a gap. They don't want to not know what's coming next. Health care is incredibly important to people at many different levels.
Yeah. One of the things, and we've had Rand Paul on the show before to talk about his plan, and one thing that he tries to address, because it's really, in the end, it's about the math, is the idea of the people that come on with pre-existing conditions. Obviously, there are folks that use a lot of health care. Somehow we have to pay for that. If we roll back the mandate and some of the other provisions that try and get healthy people to pay for it, seems like the only other way to do it is to pool people across state lines who have these pre-existing conditions and maybe to target the government's money at their pool. Or how do you pay for those folks, do you think?
I think, our approach is a couple of different ways. One is, as you correctly point out, across state lines. You spread risk across a greater group of folks, and you allow buying power in different states, so there's a competition that ultimately impacts pricing. But what we're also talking about is if you look at the pooling, it can occur at sort of different levels. I mean, the whole idea of a health savings account is the idea of having people spend their own money, which I think, again, begins to impact pricing. I mean, I think that what we're, I guess, really getting at, though, ultimately, is insurance being insurance. One of the fatal flaws to Obamacare was you could wait until your house was burning to buy home insurance. You could wait until your car was wrecked to go out and buy auto insurance. That's not the nature of real insurance, and yet that's what the Obamacare plan did. And so you're not having people paying ahead of time based on anticipated risk. They're simply buying for not a risk, but an actual occurrence. And so we're fundamentally changing the way you prepare for the notion of a pre-existing condition and pay for it.
Yeah, I mean, the problem with that is that the cost for a lot of people who use a lot of insurance has to go up. I mean, that's kind of the only way that you can pay for those people. If what you're talking about is allowing families who only want catastrophic insurance, like you said, they just want to insure themselves against the really big expense, if you let them do that, that's sort of cheaper out of the gate, and they're not contributing to the care of the really sick people. And if you let younger people not buy huge insurance plans that cover absolutely everything, that takes a lot of them. All this was supposed to pay for the people who use a lot. So how do the people who use a lot, are they going to have to just pay more? Is that the bottom line?
In some instances, I suspect they would. But what we don't have right now is true insurance. Instead of people paying it for years and then sadly, tragically, they get cancer, it's they wait until they get cancer to go on insurance. And so you don't have the power of compounding. You don't have the power of money actually going into a plan that prepares for an eventual horror that might come your way. You're waiting to pay for it when it actually occurs. So it undermines the very nature of insurance.
From a pure political point of view, the Democrats have no incentive to come in and help with this. They've been labeled with the failure, and now, I mean, unless they do it out of the goodness of their hearts because they really want the best for people, they don't have a lot of incentive to come and pitch in. Do you think that you can get enough Democrats to come and support the plan, or do you think that Republicans can do it on their own?
I think they're going to have to ultimately, because for the reasons, again, you suggest, there's not going to be a lot of reason to go out and help the Republicans come up with a plan. But it's spiraling downward. For instance, in South Carolina, we're down to just one provider on the Obamacare side, or the Affordable Health Care side. And inflation last year, in terms of premiums, was 29%.
Yeah.
And so I think one of the things, what many people said, let's just let it fail. But if you do that, a lot of people are going to get hurt in the process. And so I think Republicans are right to say, let's come up with a plan that begins to address this, though it may be painful politically.
Yeah, we'll see. All right, Congressman Sanford, thanks for coming on. Good luck to you.
My pleasure. Thanks.